So for my general medical conditions presentation, I cover rubeola and parotitis, aka mumps. My name is Brandon Ruiz, and right below is the link to the mumps quiz. Now, a description of the condition: mumps is distinguished as a viral illness caused by the paramyxovirus or the RNA virus. The RNA virus is a member of the rubella virus family, and the rubella virus is within the genus paramyxovirus, a member of the family Paramyxoviridae. Now, the average duration from the time between being exposed to the virus and the incubation period is usually 16 to 18 days, but it can also range from about 12 to 25 days. Mumps is a contagious disease that leads to painful swelling of the salivary glands, and saliva is a common mode of transmission for the virus. Alternative names would be epidemic parotitis, viral parotitis, or simply parotitis. Mumps may also infect the central nervous system, the pancreas, as well as the testes. Now, mumps is caused by a virus, and the virus replicates in the upper respiratory tract. Transmission from person to person is spread through contact with saliva or drops of moisture and respiratory secretions from the nose and mouth. A common form of transmission would be sneezing. It can also be spread through direct contact with items that have infected saliva on them. Other forms of viral transmission could also be through urine and cerebral spinal fluid. Chemical agents such as ether, formalin, chloroform, as well as heat and ultraviolet light can render the virus inactive. Now, mumps infection can occur at any age, although often occurs in unvaccinated children ages 2 through 12. The risk of spreading the virus increases when an individual is in contact with someone who has mumps. And when a person is ill with mumps, they should avoid contact with others after being diagnosed by staying home from work or school and staying in a separate room if possible. These essential precautions must be followed immediately, and someone with mumps is generally infectious from 2 days before if swelling is present or occurs, and up to 5 days after onset of illness. The contagiousness level of mumps is similar to influenza and rubella, but is less than for measles and varicella. It is most contagious 48 hours before the illness begins. Examples of spreading the virus would be coughing and sneezing, fluid secretions from the mouth or nose that comes into contact with your eyes, nose, and mouth, as well as sharing beverage containers, eating utensils, cigarettes, vapes, so forth, as well as kissing and oral transmission. And symptoms of mumps, the most common, as we can see in the picture of the child right here, is swelling of the parotid glands. Now, the parotid glands are the largest salivary glands located between the ear and the jaw. Tender swelling of these glands occurs as an acute unilateral or bilateral onset lasting around 2 days. So parotitis is the most common symptom that we can see, and swelling of the temples or jaw is your temporomandibular area. Other symptoms include face pain, fever, headache, sore throat, loss of appetite. Now, other symptoms that are only found within males would be testicle lump, testicle pain, scrotal swelling, which is known as orchitis, and orchitis occurs in 3 to 10% of post-pubescent males. So this diagram right here is an example of orchitis. Other characterizations include myalgia, anorexia, malaise, and up to 30% of mumps infections are asymptomatic. And additionally, 40 to 50% may present only non-specific or primarily respiratory symptoms. Other ultimately rare complications include oophouritis, meningitis, mastitis, pancreatitis, permanent deafness, sterility, and death. It is also highly rare, but encephalitis can occur, which is swelling of the spinal cord and the brain. Now, effects with sports performance with the presented symptoms above the mumps virus could hinder the sports performance of the athlete. Not only would it weaken the athlete's performance, but it could also spread to possibly every player on the field or court of both teams. Due to the viral illness, an athlete infected with mumps would have to withdraw themselves from any future games until the mumps infection has diminished and cleared. Now, treatments. Mumps can be diagnosed through a combination of symptoms and physical signs and laboratory confirmation. Mumps is usually diagnosed by the healthcare provider by looking at the symptoms. However, laboratory test results will be needed for diagnostic confirmation. Healthcare providers can collect test samples from the mouth, throat, through urine, and or by blood. There are other illnesses that present similar symptoms, such as parotitis, although not all cases of mumps develop the characteristics of parotitis. Thus, correct laboratory test results are of great value. Now, with diagnostic confirmation, laboratory testing must be done for confirmation due to symptoms being nonspecific. The RT-PCR testing along with serologic testing should also be complete for confirmation. And certain results of mumps may appear falsely positive due to cross-reactivity with other viruses. There is no cure or specific treatment for mumps, but medical care and supportive treatment can be provided to help relieve symptoms and address any further complications. Some of these factors that can alleviate symptoms would be to apply ice or heat packs to the neck area, bed rest, drink extra fluids and consume softer foods, gargle with warm salt water, fever reduction, take Tylenol for pain relief, although it's strongly advised not to give aspirin to children with a viral illness due to the high risk for Rey syndrome. People infected with the virus will do well most of the time, apart from other organs involved than just the salivary glands. Once the illness concludes in about 9 days, the person will be immune to mumps for the remainder of their lives. Furthermore, post-exposure use of vaccines or immune globulin is not effective. Now, prevention. The MMR immunization vaccine protects against measles, mumps, and rubella. It should be administered to children as a first dose when they are 12 to 15 months old, with the second dose being when they are 4 to 6 years old. Adults can receive the vaccine as well, but they should consult with their provider before. 2 doses of the vaccine are about 88 to 90% effective at protecting against mumps, but 1 dose is about 78 to 80% effective. It is still possible for someone with 2 doses of the vaccine to contract the infection. Thus, in close contact settings with highly vaccinated communities, an outbreak can still occur. Nonetheless, high vaccination is effective in limiting the size, duration, and spread of mumps. And this concludes my presentation.